Imagine you're sick, really sick. You've got a fever, your stomach hurts, and you can barely stand up. So you drag yourself to the doctor. He takes one look at you, picks up a little cup, leans in very close, and tastes your pee. And that actually worked, kind of. Let's go back to ancient Babylon, roughly 1750 BCE. If you were sick, your family would carry you into the street, literally lay you down on the pavement, and wait for strangers to walk past. The Greek historian Herodotus recorded this: the law required anyone who had suffered a similar illness to stop and share their advice. Imagine you're lying on a busy street, you've got a rash, and everyone who walks past is suddenly your physician. Oh yeah, I had that once. Rub some goat fat on it. Sorted. Healthcare by committee. Before Yelp, before Google, before literally anything. It was this. Ancient Egypt, 3000 BCE, was doing surprisingly real medicine. The Edwin Smith Papyrus, written around 2600 BCE, is the world's first known medical textbook. Egyptian doctors examined patients systematically: fever, breathing, swelling, pulse, color, appetite, and sleep. Sound familiar? Because that is literally what your doctor does today. They also had diagnostic tests. To check if a woman was pregnant, they told her to urinate on 2 bags, one with barley, one with wheat. If either sprouted, pregnant. Barley first, boy. Wheat first, girl. In 1963, modern scientists tested this in a lab. Result: 70% accurate for detecting pregnancy. Elevated estrogen in a pregnant woman's urine genuinely promotes seed growth. They had no idea why it worked. They just noticed that it did. That's science. Now we get to ancient Greece, where medicine gets more organized and absolutely more unhinged. Meet Hippocrates. Around 400 BCE, he introduced the 4 humors: blood, phlegm, yellow bile, and black bile. Balance these 4, you're healthy. Too much of one, sick. Too much blood, feverish and weirdly cheerful, suspicious. Too much black bile, depressed. You have too much black bile. To diagnose the imbalance, doctors would look at your complexion and feel your pulse, check your urine, and ask about your sleep, diet, mood, and where you lived. Galen, writing 200 years after Hippocrates, wrote over 2 million words on medicine, roughly 20 full novels. His textbooks were used by doctors for 1,400 years. And if the diagnosis was too much blood, easy, they just removed some. Bloodletting. Take blood out of a sick person. That was the treatment, until the mid-1800s. History's most confident wrong answer. Let's go back to the pee thing, because this deserves more time. In medieval Europe, urine analysis, called uroscopy, became so prestigious that it defined a great doctor's entire reputation. Physicians developed the urine wheel, a chart with 20 colors of urine, each mapped to a specific illness. Clear? Probably fine. White and thick? Kidney issue. Dark brown? Liver. Sweet-smelling might be what we now call diabetes. In the 1600s, physician Thomas Willis tasted a diabetic patient's urine and noted it was, quote, wonderfully sweet, as if imbued with honey or sugar. He named it diabetes mellitus, mellitus meaning sweetened with honey, based on a taste test. Was he the first to figure this out? Possibly, or possibly just the first to publicly admit to tasting pee. By the 1200s, patients would send a stranger to the doctor holding just a flask of urine. No patient, no symptoms, no context, just, here's the key, you figure it out. Doctors hated this. Patients demanded it anyway. This continued until the 1860s. Victorian England, steam trains, Charles Dickens, pee diagnosis. To be fair, ancient medicine wasn't only strange guesses. Ancient Egypt pioneered surgical tools, scalpels, clamps, forceps, and dental pliers. Many are nearly identical to what's used in hospitals today. Greek physicians introduced detailed patient history taking. Roman doctors used aqueducts and sewage systems to prevent disease. thousands of years before germ theory was even a concept. They didn't know about bacteria, but they noticed clean water meant fewer deaths. That's pattern recognition. That's proto-science. The words Hippocrates introduced, sepsis, trauma, diagnosis, symptom, therapy, we still use every single one today, unchanged. These people had no microscopes, no blood tests, and no x-rays. They had their senses, their observations, and a terrifying confidence that if they looked at enough bodily fluids, they could figure it out. And sometimes, they could. So, ancient doctors figured out your illness by looking at your face, feeling your pulse, asking about your dreams. Yes, dreams counted. And when all else failed, they tasted your urine. Some of it worked, some of it didn't. Most of it was done with extraordinary confidence by people who genuinely believed they were helping you. Which, in a way, is not that different from Googling your symptoms at midnight and convincing yourself you have 7 rare diseases. Different era, same vibe. If this made you feel weirdly grateful for your next urine test, share this with someone who complains about going to the doctor. They need a little perspective. And don't forget to like the video and subscribe to the channel.